am very passionate about the impact and the difference that we get to make every single day. There's not a day that goes by that we are not able to help people, and that's what's important. We're able to give back to the community and for the betterment of our patients.
You have a pharmacist on staff within the care team, and it's an integral model where the physician and the pharmacist are talking together along with other medical staff as well. There we talk and making sure everything's safe, and if there's any recommendations on there that we can collaborate with each other and making sure that best possible outcomes. We have a lot of resources and we want to make it convenient for you and making sure that life can be a little bit easier.
In the previous world, before Partners in Primary Care, I felt like I was a good physician. I felt like I took care of my patients, gave them instructions, and tried to empower them. But a lot of times felt like there was more to be done and wasn't sure I was a person who could actually do it. But a lot of times I left work wondering, did I help somebody today? Did somebody really get empowered from their interaction with me? And I trust some did, but maybe there were more that could have. And so once I came to work with Partners in Primary Care and started being engaged, involved in this integrated care model, and then the success stories just started coming. We started seeing people who had a turnaround, who started, not needing to go to the emergency room, not being hospitalized, taking care of their chronic diseases, starting to see control in blood sugars and control in respiratory symptoms from their COPD. I said, this is it. This is why I became a physician. And so it gives me optimism about my role as a physician, that yes, there are those that you can help, but there are many more that you can help when you work as a team.
So I think the integrated health model is better for patients because we don't just see the patient and the problem. We see everything about that patient, and we treat that patient in a holistic way. We take into consideration not just their medical problem, but their financial ability to take care of the medical problem, their support system at home, their emotional needs, and we manage their health care in a more holistic way.
So we're totally unique in the sense that it's a full team, and not just a team that we talk about, a team that's actually here, a team that wants to physically, we say touch, but basically interact with that patient 6 to 8 times per calendar year. So that might be 3 times with the physician and 2 times with a behavioral advocate, but it might be also another time with a social worker. So it's a team that works together making sure that patient stays well from a holistic standpoint.
We also have social events that we're holding in the activity centers. For example, I hold a behavioral health education series quarterly. The last one I just did was on how to reduce anxiety. So we did breathing techniques, and it was a great turnout, and people came to socialize, but then also learn about mental health. They come in and learn about their physical health. So it isn't just they're coming here to see their doctor. It's not in that traditional sense. This is kind of becomes like family to them, and they're much more engaged.
You would see a lot in this population of people that could receive help that never do, because they truly believe it's for someone else. But the good thing is, once I develop that relationship, they're able to tell me, okay, Nicole, I know I said I just need help with meds, but I'm struggling to be able to pay for my house. So I'm able to look at them as a whole and say, okay, these are the things that we can try to do to help you.